Welcome to Expert Opinion. This video brings together important excerpts from our prostate cancer webinar, which are presented by healthcare professionals. Produced by PROCURE, Expert Opinion is intended to provide reliable additional information for people newly diagnosed or undergoing treatment, as well as for their families. This video discusses hormone therapy from several angles. Why am I receiving hormone therapy? What should I know about this treatment? And how do I manage side effects? First of all, why is hormone therapy used? Let's listen to Dr. Daniel Lewinshtein, surgeon urologist and head of the urology department at the Centre Hospitalier Pierre Boucher, to understand the role of hormone therapy.
So what are the goals of hormone therapy? So obviously the main goal is to prevent your body from making testosterone. And then the second goal is from stopping the cancer from either growing or spreading. So used alone, hormone therapy will not cure your prostate cancer. What I tell patients is it slows it down, but it can be very efficient at slowing it down. It is, however, an effective treatment to reduce the size of a tumor before radiation. So as I said previously, before radiation therapy for high intermediate risk disease, you will receive hormone therapy, which will reduce the size, which will increase your benefit from treatment. It can also increase the effectiveness of radiation therapy, as we said before. It can control progression of remaining cancer cells after treatment as well. It can treat prostate cancer that is advanced or that may come back after initial treatment, such as surgery or radiation. And finally, as we know, one of the interesting things about hormone therapy is that it can come into contact with prostate cancer cells anywhere in the body, whether they be in the prostate bed, in the lymph nodes, in bone, or any other metastatic site. For the most part, until the hormonal manipulation may not become effective anymore.
Knowing why hormone therapy is used is one thing, but the when is another. Let's listen again to Dr. Lewinshtein explaining when hormone therapy should be introduced and how it works.
Trials in the radiation oncology field that were done about 10 to 15 years ago now by Bola showed clearly patients that were receiving radiation and or brachytherapy for unfavorable intermediate risk benefited from a short-term hormone course, usually 4 to 6 months of hormones, which is given in the time period starting just before radiation treatment, and then usually subsequently for another 4 to 6 months. And this was shown to decrease the risk of PSA recurrence. And more importantly, it was also shown to increase survival and has become standard of care for patients receiving radiation. The goal, of course, in unfavorable intermediate risk patients is curative, and that is the utility of the hormones to help in the cure of those patients. Patients that receive external beam radiation and or brachytherapy for high-risk disease receive long-term hormone therapy. So classically, these patients received approximately 3 years of hormone therapy, and now some would have side effects and would possibly stop it beforehand. However, there was an interesting trial actually done here in Quebec about 7 years ago now that showed that patients that had radiation therapy for high-risk disease and were supposed to receive 3 years of hormone therapy, they actually had similar survival outcomes and similar biochemical recurrence outcomes if they only received 1.5 years of hormone therapy instead of the total 3 years. So standard of care in most centers treating with radiation therapy for high-risk disease in Quebec is to give 1.5 years of hormone therapy. And that helps patients with respect to the side effect profile as well. The duration being shorter, the bounce back of testosterone production is faster. So all patients that had metastatic prostate cancer would receive hormone therapy. Some of them now, for the last 1.5 years, 2 years now, can receive upfront what we call advanced hormone therapy. So different agents that either help to block the production of testosterone or block the interaction of testosterone with its receptor. And this is a new indication, classically for the last about 80 years, since the time of Huggins, who was a Canadian scientist that discovered the utility of hormone therapy. There wasn't a lot of new discoveries, but this new discovery of this new advanced hormone therapy helps to protect patients from progressing and helps to prevent development of metastases.
Your role being as important as the treatment when prescribed hormone therapy. Let's hear what Dr. Lewinshtein recommends.
So what is your role? I think this is the most important. What is your role as the patient? What can you do to try and prevent these side effects? So I think it's important with your urologist or with your family doctor to discuss the different hormonal therapies that are available. How can duration affect your side effects? What are the long-term side effects, such as cardiovascular disease? You should also tell either your internal medicine physician or your family doctor, and they should also know that you are now on a hormonal agent, and they should be aware of these possible changes that are occurring or may occur in the near future. You should also pose hard questions to the urologist or the radiation oncologist or the oncologist as to whether these recommended treatments are going to affect your current diseases and whether the risk-benefit analysis has been done. Ask as well if you could possibly go on intermittent hormone therapy if your PSA is unstable, and that is really only in specific clinical scenarios. So, as I said priorly, really discuss these things. You are your best advocate. Make sure you have a family doctor. Make sure if you do have one that they're aware of what's going on, and make sure that you have your animal checkup. And I know it's very hard to get a family physician in Quebec, but we should all try our hardest to have one that follows us along with our specialist. So what you can do. So probably the number one thing is physical exercise. Quebec doesn't have specific recommendations on this, but Cancer Care Ontario has done multiple trials and has shown, not just specific for prostate cancer, but patients doing 150 minutes per week of moderate intensity exercise. And this is ideally to be split among 3 to 5 sessions, in addition to strength training, which specifically has been shown to prevent bone issues, can help immensely in preventing side effects of the prostate cancer treatment. One of the easiest things that you can do is just go out for a walk. It's free, it's easy to start doing, and you can start it any day of the week that you want to. So as I said, multiple prospective trials, large trials in oncology, patients have shown that if you do exercise, you're going to have an improvement and you're going to have an increase in your ability to do more exercise. You're going to have better cholesterol levels. You're going to have a likely risk reduction in your risk of heart attack, your risk of stroke, your risk of having clots in your veins or in your arteries. It's also been shown to decrease your overall mortality in specific trials. It's going to decrease your risk of either having progression of your diabetes or having new onset diabetes with new hormonal manipulation. And finally, results that you can see is that it will help with weight gain and obesity. So the second main thing is diet. So as we said, the first thing is exercise. The second aspect of you as a patient is diet. So really the main thing is try to avoid high fat, high sugar diets. And the other thing is not necessarily to follow a new fad diet such as high protein diets, but really follow the Canadian food guidelines and everything in moderation. And if you don't know exactly what to eat, obviously you can go on any reputable website and look up these different types of diets or different types of diet profile, as well as looking for the help of a nutritionist. They're professionals and they can give you very straightforward, basic plans, which one can follow, which can also be very commercially viable to help reduce weight gain and prevent diabetes. The last thing that you as a patient can do if you do smoke is to not smoke, obviously, and that is easier said than done. But there are different therapies and adjuncts that are available to try and prevent smoking. And the other thing that a lot of people may not know, but even if you do not smoke, but you are in the presence of smokers, so someone that smokes in your house, is exactly as if you are smoking yourself. So try and avoid those situations.
If the side effects of hormone therapy are often feared, Dr. Lewinshtein wants to clarify a few things on this subject. Let's hear it.
So what exactly, I think this is the most important part of the talk tonight, and this is what affects you, the patient. What exactly are the side effects of these different agents, and how can we mitigate them? So the side effects depend on a couple things. One is how long you're taking the molecule. So if you're just taking a hormonal agent for 2 to 3, 4 months, you're going to get your testosterone production back. However, if you are on it for years, and that really depends on each patient, patients that have underlying metabolic syndrome, diabetes, hypercholesterolemia, high blood pressure, and they're on these agents for a number of years, more than 3, 4, 5 years, they sometimes either get partial production of testosterone back or no production of testosterone back. And it really is patient dependent. And it's also dependent on your age, and as I said, your overall treatment and duration.
Finally, Dr. Lewinshtein cannot stress enough the importance of using your appointments as an opportunity to talk to your specialist and discuss your side effects or other concerns.
You are your best advocate. When a patient comes into my office and they have all their medications with them and they have all their prior history and all their prior interventions, and they know what's going on, and they have their questions written down, that helps immensely me treat them properly. Sometimes they may think that we have access to all the information. We do have access to a lot of the information in 2021. We sometimes may not have access to things such as pathology reports. We may not have access to things such as physician notes that were done outside of the realm of our system. So a patient that is well prepared, that has their prior results with them, that has their prior treatment history with them, will immensely help us and immensely help them to get them a better treatment.
You have questions, concerns, worries? Contact us 7 days a week at 1-855-899-2873 to discuss confidentially with one of our nurses specializing in uro-oncology, who will take the time to listen to you and provide you with informed answers. The PROCURE support team is there for you.